Welcome. I am Misty Lechner. I am the Advocacy Project Director for American Heart Association, and I'd like to welcome everyone to the Healthy Food on Government Property webinar today. Nutrition guidelines for food sold on government property is a topic that I know many food policy councils and other communities across the state and the country are working on today. We are very lucky to have the expertise of staff both at American Heart Association and Public Health Law Center to be able to translate evidence-based policy recommendations to really fit the Kansas context. So for that and many other reasons, I am pleased to be able to work with Public Health Law Center to host this webinar. American Heart Association has been working with Public Health Law Center on several tools that will pave the path for you to work on these local policies. We've worked with a handful of communities across Kansas on similar policy campaigns. The tools we will discuss here today will help councils and coalitions start from the same place and begin to speak the same language when approaching local nutrition policy. And then I do hope that you can call or email me so I can work with you and provide you the technical assistance you need to really operationalize the content of these tools that we'll be discussing so you can more easily take action in your community. Throughout this webinar, I will go ahead and continue to encourage you to type questions into that Q&A box, which is at the bottom of your screen. And at the end of the presentations, we will answer all of your questions and also address your comments. So at this time, I'm going to introduce our speakers today. Natasha Frost provides legal technical assistance on public health issues to communities and local governments. Prior to joining Public Health Law Center, Natasha worked for the Alliance for Children's Rights, a public interest law firm that provides a range of legal and other services to children in foster care in Los Angeles County. As the Benefits Program Director, she created and managed a program that represents children and their caregivers to obtain public benefits. While there, she handled more than 300 administrative fair hearings and recovered over $7 million in funding on behalf of needy children. She also provided consulting and technical support to systemic efforts, including litigation and legislation, designed to overcome barriers to accessing benefits and services. Ryan Lee, a policy analyst at the Public Health Law Center, provides legal technical assistance rooted in public health research to state agencies. State agencies, local governments, and public health advocacy groups nationwide on access to healthy food and active living initiatives. Ryan is a graduate of the University of Minnesota and the Johns Hopkins Bloomberg School of Public Health. As a graduate student, he worked as a research assistant at the Center for a Livable Future, where he worked on several research projects related to food security and nutrition, including enhancing regional food system study, a food retail intervention, and an evaluation of SNAP-based incentive programs at farmers markets in Baltimore, Maryland. And at this time, I will now turn it over to Natasha to kick us off.
Well, hello, everyone. My name, again, is Natasha Frost, and I'm a senior staff attorney at the Public Health Law Center. And so the Public Health Law Center, as Misty mentioned, is located at a law school, Mitchell-Hamlin School of Law, and there's a picture of us there in the glories of being not in winter. And we are a nonprofit organization that works across the country on providing what's called legal technical assistance to communities around the country. And so legal technical assistance includes doing a series of things, and we have been extremely lucky to work on legal technical assistance in Kansas based on a generous partnership with the Kansas Health Foundation, Blue Cross Blue Shield of Kansas, and American Heart Association, among others. And so we have done a lot of legal research specific to the Kansas context, and we're going to highlight some of that legal research today as it relates to food procurement. We've also worked on policy development, implementation, and this is really important for communities like yourselves who are working to improve the food environment at the local level And so many of our tools that we have specific to Kansas actually look through the Kansas specific lens on what policies make sense and what other Kansas communities are doing to improve the health of Kansas through policy development. And we do this through publications and trainings like today. We don't provide direct representation, and we don't actually lobby for those policies that we are going to highlight today. And so that's kind of the summary of what legal technical assistance is. And again, I think the most important part of our work as it relates to Kansas and other communities is providing that legal technical assistance within the frame of equity. And what's really important to understand is that when you have things like food policy, which many of you are working on, a one-size-fits-all approach, it doesn't really make any sense. So having equal policies across all different communities is not really what the Public Health Law Center or others that we work with are really striving to achieve. Instead, what we're trying to do is figure out what sort of spike, if you will, makes the most sense for your community. And this is really important within the context of the food environment, because every single community has a different food environment, has different challenges and opportunities. So for example, if you have a situation where a community is really involved in or has a lot of opportunities for local food sources, that is something that you would consider in the policy. And this equity framework is framed within the core social determinants of health, because even though you might be working on the food environment, community members are still situated in a larger community context. So for example, a community member who is trying to have healthier food might also be struggling with things like housing or focusing on specific issues related to unemployment or low wages. And so you have to look at the whole community context as it relates to the food environment. And so the work that the Public Health Law Center does through our technical assistance model really combines the concepts of equity within that social determinants of health. And the way that we do this is through policy change and systems change and environmental changes. And today we're going to really focus on the policy change efforts for food procurement. Policy can happen at a variety of governmental levels. For example, tribal governments have their own sovereignty related to food, and many tribes are actually developing their own food codes and other policies that impact the food environment. The federal government also has several policies related to the food environment that impact food procurement. We'll talk about a few of those today. The state of Kansas has procurement, things that impact the food environment. And when I say the word procurement, what I mean is a government's ability to purchase food. So they're procuring the food. And so the state of Kansas has some requirements related to food safety, for example, that impact the local level procurement of food. But what we're going to focus on when we talk about policy is the local government, so a city or a county, or an organizational policy. So that might be a task force or another governmental entity at that kind of organizational level. So a food policy council, for example, that's not based specifically in a governmental entity. And so those are the sorts of policies that we're looking to highlight today on how we can actually change the food environment. And I'm going to pass it off to Ryan to talk about what that means in the context of the food environment and procurement policies in Kansas at the local level.
Thanks, Natasha. As Natasha mentioned, today we'll be discussing food that is served on government property, which is defined as any property owned, operated, or managed by the local government. And this can be a city, a county, township, or park and recreation district. And there are generally three broad types of food operations that take place on government property: vending, food services, and institutional feeding. And today we're going to walk through an example using vending. It's important to note that schools, colleges, and universities are governed differently, so they will not be included in today's presentation. So why focus on government feeding? So we know that food and beverages high in sugar, calories, and salt are linked to diseases like heart disease, diabetes, and high blood pressure. We know that evidence suggests the importance of healthy environments in reducing these chronic diseases. We're also aware that large numbers of people, including employees, community members, clients, and visitors, interact with government agencies and government property. So from a public health perspective, they're a good place to focus healthy eating efforts. Public agencies also fund and work on efforts to curb diet-related chronic diseases, so it's important that they walk the walk. So how do you make government feeding operations more healthy? You do so through procurement policies. And procurement policies establish requirements and set standards for the types, sources, and cost of items that government agencies buy, including foods and beverages. State-level procurement policies do not typically apply to local governments, meaning that local governments are free to determine and implement their own policies. However, local governments may choose to model their procurement procedures after those used at the state level. Local governments can enact procurement policies in various ways, including through executive orders, resolutions, or ordinances. Most local governments in Kansas do not have policies outlining specific requirements such as nutrition standards or marketing strategies for procurement. However, many local governments use requests for proposals and contracts with vendors who then supply the foods and beverages offered on government property, including nutrition standards and other requirements that promote the consumption of healthy food and beverages in that contract language will ensure that vendors are obligated to abide by those requirements. Local procurement policies and contracts can be an effective mechanism for setting nutrition standards in food service operations and are most impactful when policies and contracts are aligned with strong nutrition standards and marketing strategies. So as I mentioned, I'm going to walk through an example of how to design and implement a vending procurement policy. So with the help of the American Heart Association, we have created a Kansas-specific implementation guide that walks through the steps of implementing a healthy vending policy and includes sample policy language, including important elements to a healthy vending policy. And we'll have a link to this resource at the end of the presentation. So we'll all be walking through a vending example here. The steps outlined can be applied to all government feeding operations. The first thing you'll want to do is get a lay of the land by looking into definitions. And so we've already defined government property, but you'll also want to define the type of operation that you'll be working on. So for vending, the Kansas Department of Agriculture and the Kansas Food Code defines vending machines as any self-service device which upon payment dispenses unit servings of food or beverages, either in bulk or in packages. Such devices shall not necessitate replenishing between each vending operation. So this can include things like your conventional food and drink vending machines, but also self-serve kiosks and drink mixing machines. Once you've defined what operation you'll be working on, you'll need to consider the relevant stakeholders. Open communication with both vendors and government staff that manages vending is a key step before and during implementation of a healthy vending policy. This will ensure that you have a consistent policy across government facilities. Engaging and communicating with vendors is particularly crucial to the success of a healthy vending policy because their cooperation is vital for effective implementation. Next, and prior to writing the policy, you'll want to understand the current state of vending operations in the areas that will be covered by the policy, including learning who the key stakeholders are, such as the contract managers, procurement officers, vending companies, etc., understanding the contracts between the government and the vendors, and assessing what the capacity is for enforcing a healthy vending policy. Having this information will allow you to identify where, when, and how to implement the policy. For example, there may not be any contracts in place. In this case, it may be easy to change the products offered in the vending machines to meet nutrition standards. Or if there's an existing vending contract, it may be up for renewal or ending soon, which presents a good opportunity to talk with vendors about updating old machines, incorporating nutrition standards into the next contract with new products. Even if there is a current contract that continues for several years, the existing agreement may allow for changing the product mix and getting newer, healthier items into the vending machines. Maybe there is already language in the contract that includes nutrition standards. It's important to know before starting a new policy. Who stocks the machines and when is also important for tracking the implementation of your policy. In addition to capturing a baseline of the vending operations, you'll also want to assess the characteristics of the foods and beverages for sale in the machines that you've identified. One comprehensive assessment tool is the Nutrition Environment Measures Survey for Vending, or NEMS Vending. This tool can be modified to include the nutritional standards and the types of vending machines that would be covered by the policy in your community. Sometimes the results from this type of assessment can reveal that it may be easier to meet new nutrition standards than you realized. No matter which assessment tool you use, the food and beverage assessment should measure characteristics such as the types of food and beverages available, both healthy and unhealthy options, the prices of both healthy and unhealthy foods, the placement and labeling of all foods, and if possible, the total sales of the foods and beverages in each location. The information collected through these assessments should inform what nutrition standards you'll include in the policy. There are many different nutrition standards for vending machine food and beverages, and some are more evidence-based than others. 3 of the best evidence-based standards are from the American Heart Association's Healthy Workplace Food and Beverage Toolkit, the Department of Health and Human Services Food Service Guidelines for Federal Facilities, and the National Alliance for Nutrition and Activities Model Vending Guidelines. Your selection of nutrition standards will be based on the outcomes from your assessment, so think about which of the 3 standards is most feasible to implement depending on the answers to your assessment questions. Whichever standards you select, they should be written into your procurement policy. Take note that some vending machines may be labeled as having fit pick options, which is a marketing program designed by the vending machine industry. The fit pick guidelines do not qualify as evidence-based nutrition standards that meet AHA recommendations. Now that you've selected nutritional standards, you need to think about the logistics of implementing those standards into vending operations. The date when the policy will go into effect is an important detail of any procurement policy because it identifies when the nutrition standards and other requirements will become enforceable. Depending on the input you get from talking to staff and vendors, you may decide on one of several options for an effective date. If there's a contract and it is ending, decide on one of the If there's a contract and it's ending soon, you may wish to start the policy before the contract is renewed, before a new one is signed, or before a new request for proposals goes out, whichever is sooner. If the local government code includes a general provision that states when laws become effective, but more time may be needed for implementation, then you may wish to write in a delayed effective date to allow for implementation of the standards. For example, if the code says that all policies must start July 1st, but you know that you can't get the policy implemented by then, you may say September 1st is the effective date. There are 2 options when choosing an implementation approach. A 100% approach requires that 100% of the items meet the nutritional standards by the effective date, and a phased-in approach allows for the requirements to be met over a specific period of time, a more staggered approach. For example, the policy could say that to start, 50% of food items and 75% of beverage items must meet the new nutrition standards, leading up to 100% application of the standards by the 3rd year. If a phased-in approach like this is used, there are several other details to think about. For starters, how will implementation be measured? Will it be measured by the number of slots per machine or overall slots per agency? Does this account for slots that are stocked or just stocked or all slots? Benchmarks for phased-in implementation will also need to be identified. So what % of requirements need to be met by which dates? Which approach is best will depend on the assessment findings from your local circumstances. Keep in mind that while monitoring implementation is important for both approaches, it is particularly critical for phased-in approaches because not all food and beverages will meet the nutrition standards right away. Identifying eligible products tailored to the selected nutrition standards is an effective way to minimize barriers in implementing a healthy vending policy. Ask to see the vendor's product list and identified food and beverage items that meet the nutrition standards that you select. If they do not have a list, the Center for Science and the Public Interest has a snack, entree, and beverage options that meet NANA, AHA, and Health and Human Services vending standards. The arrangement of items within a vending machine is also an important factor for sales, and therefore an important part of this kind of policy. For example, research shows that placing healthy products at eye level improves their visibility, making them more likely to be purchased. Selling healthy food and beverage items at the same or lower price than unhealthy items is also an effective way to promote purchasing of healthy items. Research has shown that lowering the prices of healthy snacks can increase their sales by up to 80%. Promoting healthy food and beverage items is a highly effective way to increase consumer buy-in and support. Marketing strategies such as taste tests to introduce new items and attractive signage to promote awareness of products can be valuable ways to encourage purchasing of healthy food and beverages. Additionally, surveys capturing consumer feedback on new products can demonstrate approval to vendors. You'll also want to think about enforcement and reviewing. So who will monitor the implementation process and how the nutrition guidelines and other standards will be enforced are key considerations. This is particularly important in the first few months of any policy's implementation because staff and vendors will be adjusting to the new requirements. Think about the results from the assessment. Who is currently enforcing the contract requirements? Do they have the capacity to monitor and enforce new nutrition standards? If not, who has the resources to take on this role? In addition to understanding who will be monitoring the policy, it's important to decide how they will do it. If possible, providing on-the-spot monitoring to ensure that the correct products are being stocked and in places at the right prices required by the policy language is highly recommended. After an initial phase of on-the-spot monitoring, between 3 and 6 months, a regular monitoring schedule should be determined to assess compliance with the contract. This will be based on resources available to local government departments and staff. Keep in mind that changes in staffing, vending machines, and stocking frequencies will require additional monitoring to ensure compliance. Providing language in the policy that calls for the nutrition standards to be reviewed and updated periodically every 3 to 5 years or so may also be a good idea. This ensures that the policy will stay current with research and revisions to dietary guidelines for Americans. Whether this type of language should be included in the policy depends on whether the staff have the expertise and capacity to do this kind of review and updating. Similarly, language that requires that an implementation report be prepared should also be included. This report could measure compliance with the nutrition standards and identify challenges and opportunities for improving implementation in the future. Also, several things to consider. Natasha?
As Ryan explained, there are a lot of things to consider just in the local context. So the assessment of the environment, what's happening now, the contracts, what the nutrition standards are. But there are also some other things to consider on the state and federal level. There are 3 key laws that impact the food environment at the local level that you need to be aware of. First is the Randolph-Shepard Act. The Randolph-Shepard Act is a federal law, and the state of Kansas also has what's called a mini Randolph-Shepard Act. And that law actually gives preference to blind vendors, so visually impaired vendors, and that are operating on federal and state property. And this is a specific program that the state of Kansas runs. And we have a fact sheet that's specific to that law and the requirements for that law. And it's just really important context for you to understand in working with the vendors that on the property that you might be assessing. And so for more information on the Randolph-Shepard Act, please visit our website that's linked here, and you can review the Randolph-Shepard Act fact sheet that we've put together for Kansas communities. In addition, there are requirements for vending machines that are currently being implemented at the federal level for through a guidance on labeling requirements. And so we've included some information about the menu labeling law which is included in the fact sheet that we're going to have on our website for you. And then finally, many of you may have heard of a preemption law that is currently on the books in Kansas, and this was specifically targeted to impact the local level food policy work, but based on some great work done by advocates, including Misty Lechner, that preemption law does not apply to governmental food options. And so we have a resource on the preemption law that's on our website, again, linked here, but we also have a webinar that really outlines how that law impacts the procurement options that you might be seeking to change at that local level. There might be other things that impact the local level procurement that we haven't discussed today, which is why it's really important that you work with both the Public Health Law Center and the American Heart Association as you work through the process. Next slide. So one of the previous slides, we've really went to great lengths to talk about the vending environment, because many of you that are working through the food policy councils at the local level are going to work on vending machines first and vending policies first. There are also other types of food environments that you might be hoping to impact. For example, at the local level, in addition to vending machines on government property, there are also food and beverages that are sold in cafeterias, cafe, concessions, or catering offsite by offsite vendors, such as those at government-sponsored meetings and events. And so if you're working with a local government on updating their, for example, the food options at the government-sponsored meetings or conferences, that's the sort of food environment that we're talking about when we talk about government feeding service. We have specifically tailored a resource that follows the same line of analysis that Ryan described above and previous in this webinar. And so we have policy options as well as key considerations for that sort of food environment. It's really important, and I will just underline this again and highlight this, it's really important to understand currently what's going on in your local context. So getting a sense of what your, for example, your city is doing as it relates to food and beverages sold in a, do they have any cafeterias? Do they have any concession stands, for example, at the local pool? Do they do any catering with offsite vendors? And then again, going through that analysis, as Ryan discussed, with identifying the existing contracts or nutrition standards that apply to those food opportunities. Next slide. In addition to those sort of, that food environment, we also have another type of food environment that local governments are in charge of, and that's what we're calling institutional feeding. So institutional feeding is the government managed food operations for custodial populations. And so those are things that could include those people that are in a correctional facility. They might be youth and juvenile justice facilities. They might be those patients in public hospitals, and also include things such as senior feeding programs or long and short-term care facilities. These sorts of custodial population care opportunities for food have some specific considerations, such as sometimes there's other nutrition standards that apply. For example, in juvenile justice facilities, often those juvenile justice facilities already follow other nutrition standards such as the National School Lunch Program nutrition standards. And so it's really important before you jump into the work to improve the institutional feeding food environment that you work with the Public Health Law Center and the American Heart Association to understand what sort of implications that work can have and how to go about doing that work. Next slide. So all three of these types of settings will be located on our Government Feeding Resources webpage, and there's a link to this below. In addition, Misty will be sending around a link to this recording as well as those resources in the next week. And we have this information housed on our website so that we can provide additional examples and resources as they become available. Currently, we just have the Kansas Healthy Vending Implementation Guide that Ryan walked through today, and we will be adding resources related to the other two settings in the coming weeks. Next slide. In addition to food procurement work that we just described, we have a lot of resources that impact Kansas communities as it relates to health. We have resources related to healthy food, biking and walking in Kansas, as well as a series of other local government and policy drafting resources. For all of those resources, you can visit publichealththought-center.org/Kansas or follow the link that's on the webpage here. Next slide. So with that, I'll pass it back to our moderator and we'll open it up for questions.
Hello, everyone. I would like to remind and encourage you all to type your questions into that Q&A box down at the bottom of your screen, should you have any questions. And I will also, at this time, go back and kind of reiterate and explain what Natasha and Ryan have both referred to when we talk about technical assistance in the Kansas context and the local context. And I'll do that while giving you all an opportunity to think through and type out your questions. So when you seek out technical assistance on some of these local government food purchasing policies, the kinds of technical assistance that both American Heart Association and Public Health Law Center could provide are things like assistance with policy writing, assistance with providing resources and expertise on vending and food environment surveys, lessons learned from other communities that have worked through this or worked with vendors to change their vending machines, communication strategy development, and of course policy analysis to see if there are other local level policies besides the three state and federal policies that Natasha mentioned that may actually impact your food purchasing policies or other contractual processes. So those are kinds of technical assistance that could be provided as you work through this campaign. So I would encourage you all to reach out to Natasha, Ryan, and myself should you need any assistance on those. And I don't see any questions in the Q&A box yet, so I will give you just a few more seconds to type those in as we begin to wrap up the webinar. I would also like to give you the opportunity, so we'll go to the next slide as well, give you an opportunity to write down our contact information in case you don't already have it. As I mentioned, I am really happy to provide technical assistance on policy planning, and Natasha and Ryan are both valuable resources to assist in ensuring legally sound policy approaches. So feel free to reach out to me or the other speakers with questions. And as Natasha had mentioned, the links to the Kansas resources that were referenced today will be distributed widely next week, as well as the link to the archived webinar. So please be on the lookout for that. And we have received one question. So what is the estimate of the amount of time a food policy council should set aside to develop this kind of policy campaign? So I will tell you, in some of the work that I am working through, it really depends. So with different policies, they've been passed in as short as just 3 or 4 months or as long as 2 years. And it is based upon the pace in which the community feels most comfortable. Natasha and Ryan, do you have other thoughts about the work on these kinds of policy campaigns from your perspective, working nationally?
Yes, this is Natasha. We have seen, similar to what you said, Missy, we've seen a very long range, and some of it actually depends on existing contracts. And so, for example, in one community, they identified that their request for proposals was going to go out to the vendors in the following, within the next 8 months. And so they worked with the city to update the language in that request for proposals to include some healthy language. And so when it went out to the vendors to bid on, it took another several months for the vendors to come to an agreement, to put in their bid and then to negotiate for what that food service was going to look like. And so from start to finish, it took over a year, but it was within a kind of an existing contract opportunity, and the public health work was done right at the start of that request for proposals, rather than coming in midstream or after a contract had already been negotiated with that food vendor. And so oftentimes there just has to be an understanding that the process does take time, because both getting a vendor in and getting a contract updated just takes time in and of itself, and then to make some changes, which might include things that Ryan highlighted, which is the change in food options, maybe trying to find the food options that meet the new nutrition standards and working really closely with the vendor to make sure that they can be successful. That just takes time, and so having the patience and the stakeholder engagement all the way through is really critical.
Yeah, and I would say the other thing that will determine on how long this takes is what I loved in another community here in Kansas that worked on this policy is they recognized that they actually had no vendor contracts at the time. So they wanted to get a policy passed that would establish nutrition guidelines for future contracts, knowing that in the next year, they thought there would be a contract coming up for vending machines in a facility that was under construction. So they passed a policy in advance of potential vending contracts that would be rolled out in the future. So that's why the local context is really important. I work with communities and will go at whatever pace that they feel most comfortable with as well. So if they need it fast and furious, we'll work on it fast and furious. But if they need to take it slow and engage all of the partners in a really inclusive and longer process, that's also okay. So our next question is, what councils have already implemented these kinds of policies in Kansas? And do you have information on what their experience was? And Ryan, I know that there were some examples in the vending resource. Did you want to mention any of those examples? I can give some information on their experience as well in working with them, but do you want to talk about the examples that were in the resource?
So in the resource, we have a few sort of success stories, and so the Lawrence, Kansas Parks and Rec Department created nutrition standards, pricing components, and product placement requirements for vending machines on park and recreation property, which was then written into requests for proposals. There's a couple other examples one is from Missouri, so it's not a Kansas specific context. And the other is from the Iowa Department of Public Health. Obviously, contexts are a little bit different. It's going to depend on what your local experiences are. But yeah, Misty, if you have experiences from communities throughout Kansas, that would be great.
Yeah, so I would say we've had a number of different campaigns that have either passed or have, in some cases, not seen through to policy passage for one reason or another. And those experiences have been all learning experiences, whether the outcome was positive or not. So on experiences, I will say it is, again, highly dependent upon the community. In working with communities that have no contracts in place, it tends to be a quicker process. In larger communities, it can be a lot more complicated. So I started exploring this in Shawnee County, where I live, and found that there are quite literally dozens of contracts that all come out of each different county department, and not led by a central purchasing agent. So that was one experience, but where it becomes really complicated to have dozens of contracts, dozens of timelines, and dozens of purchasing agents that all would need to be brought on board to pass one overarching policy. And then there are others where the vending environment might simply be 3 or 4 machines and no contracts and filled by employees. So those tend to be focused on the employee experience and employee buy-in rather than purchasing agent buy-in. Because if the employees are bought in and the person in charge of filling the machines don't feel like they will be verbally attacked, it's much easier to pass that kind of policy. So that's the kind of experience that kind of brings me to the next question, actually, is there technical assistance on facilitating those stakeholder conversations and kind of bringing these councils to the table? Those are the kind of conversations that actually I facilitate on a local level. As we explore where are the machines, how are they filled, who are the contracts with, who are the purchasing agents, that's when we determine what's the right policy fit, where there's political will, where there is actual employee and community buy-in, and where there might be resources to assess. So that's where that sort of technical assistance and facilitating the stakeholder conversations gets incredibly tailored to the kind of policy approaches that are needed. And I share the experiences of the other communities. So if someone's concerned, I can share the experience of a similar community that may have worked on something like that. Let's see, I'm not sure how to best market some of these conversations. Oh yeah, that's the other thing, that sort of communication strategy development, that's a part of the stakeholder conversation. So whatever we are concerned about coming up, we can prepare talking points and prepare communication strategy to help mitigate the effects of I hate to say it, but a negative Nancy in the group. Let's see, one more question. What would be some advice on preparing to pursue a food procurement project in terms of council capacity, organization, and relationships? So Ryan and Natasha, I'll kind of let you kick this off in case you have any thoughts on this. Because I know, Ryan, you've worked with a couple of communities as well on preparing for policy campaigns and sort of assessing that. And do you have any thoughts on preparing to pursue a policy project such as this?
Yeah, so that's where stakeholder engagement, that's where I would sort of lead off with that. And it's, you know, sort of half science, half art. And so understanding where, in terms of your own capacity and resources, what you have to contribute to pursuing such a project, but also understanding the government's readiness to move on to something like this. And so some of that is going to be, you know, conversations that may be uncomfortable or sort of feeling each other out. And then there's this, and then it's just the technical side, I guess, is understanding, well, what contracts are in place, what vending machine, how many vending machines are there, where are they placed, what type are they? And that's more the technical side, I guess, where it gets into, well, what are we asking for here? Like, what are we, what's the lift on the government side? And so having those relationships in a good place prior to sort of that ask is critical.
Natasha, is there anything you'd like to add?
Yes, I would also just say, one of the nice things is that, the Public Health Law Center has done a lot of analysis of local level policies in a variety of communities across the state based on our partnerships with, again, the Kansas Health Foundation, Blue Cross Blue Shield of Kansas, KDHE, AHA, as well as Casey Healthy Kids, and other state partnerships. And so we have done a lot of research at that local level. And so in addition to kind of the ground softening with your stakeholder engagement and just kind of assessing your own capacity and your local government's willingness to move forward, you could also just reach out to see if we've done any analysis of what are the existing contracts, what are the existing policies, kind of where are you at? Has there already been a campaign in your community or around your community that you can piggyback on or use as a springboard? We at the Public Health Law Center and also in partnership with the American Heart Association, we've been able to already gather a lot of resources. So there's no reason for you to start from scratch.
Yeah, and I would also say if you can identify like a champion for one of these procurement policies, or so if it's whether it's someone on the government side or who works in contracts, or if it's someone maybe higher up, or even just a collection of people who are interested in this, who are really passionate about this, that they work in a government agency and they want to see changes made to the vending machines or cafeteria in that agency. If you can identify them and sort of leverage that relationship, that can go a long way in terms of having someone on the inside to really push this along and create momentum.
And in addition to the resources we've talked about today as it relates to preparing to pursue a project or facilitating these stakeholder conversations, I will go ahead and plug one more resource that you all in attendance might be interested in. And on August 15th in Salina, there will actually be a capacity building and facilitation workshop specifically for food policy councils in Kansas. So registration actually was just opened this morning for that facilitation workshop. And it really is about how you can facilitate difficult conversations to get more internal and external partnership engagement in some of these strategies. So I will make sure that that information is shared out with you all when we share out the rest of these resources too, in case you would like to sign up and be a part of that workshop. Okay, there are no more questions coming into this Q&A box. So seeing that there are no more questions, we will go ahead and wrap up. Again, feel free to write down that contact information, and here is the contact information for Public Health Law Center. I would like to thank our panelists, Natasha and Ryan, for leading this webinar, but also I would like to thank each of you as attendees for your time and your attention and your really thoughtful questions. And I hope you all have a very lovely day. Thank you so much.